Hey everyone, welcome back for another deep dive.
Mhm.
Today we're tackling something that's super important for, well, pretty much everyone. And it's something that a lot of people probably don't even think about.
Right.
We're going to be doing a deep dive into hypertension.
Uh-huh.
You hear about it, but do you really understand what it is?
It's one of those things that, it's really common,
Yeah,
but a lot of people don't really know much about it until maybe they're diagnosed with it.
exactly. And, we had a really interesting video come across our desk
Yes.
a while back called Understanding Hypertension, Causes, Symptoms, and Treatments.
Mm-hmm.
And it kind of opened our eyes, to how prevalent this is.
Mm-hmm.
It's crazy. Like almost half of adults worldwide have high blood pressure.
It's a huge number.
But most of them don't even know it.
They call it the silent killer for a reason.
Yeah.
You don't necessarily feel it happening.
Right. So let's break this down, for our listeners out there who maybe haven't thought about this in a while. Can you just give us like the real basic definition of what exactly hypertension is?
Sure. So hypertension is basically just a fancy word for high blood pressure.
Okay.
And what that means is the force of your blood pushing against your artery walls is just too high,
Okay.
for a long period of time.
And so like why is that a problem?
Well, you can kind of think of it like a garden hose.
Okay.
If you've got too much pressure in that hose,
Yeah.
eventually it can start to,
Wear and tear.
wear and tear, damage the hose.
Burst even.
Burst, exactly.
Yeah.
And it's the same with your arteries. Over time, that high pressure can damage the walls of your arteries,
Gotcha.
make them less flexible, which can then lead to all sorts of other problems.
And that makes sense. And, I remember going to the doctor and getting my blood pressure checked,
Right.
and they always give you those two numbers,
Yeah, yeah.
the systolic and the diastolic. Remind me again, like, what are those?
Yeah, so systolic pressure, that top number.
That's the pressure when your heart is actually beating.
Right.
It's squeezing, pushing the blood out.
Okay, so that's like the active pressure.
Yeah, exactly, the active pressure.
Gotcha.
And then that bottom number, the diastolic pressure,
Mm-hmm.
that's the pressure when your heart is at rest
Okay.
between beats.
So like the baseline.
Exactly.
Yeah, okay.
And a healthy blood pressure reading is typically around 120 over 80.
Okay,
So 120 systolic, 80 diastolic.
got it. And anything higher than that is where we start getting into
Yeah, that's when we start to get concerned.
hypertension territory.
Exactly.
Okay, now, so like what causes this to happen?
That's a great question, and it's actually a combination of factors.
Okay.
So, genetics definitely play a role.
Okay.
Some people are just predisposed to high blood pressure because of their family history.
Right.
But then there's a whole host of lifestyle factors that come into play as well.
Gotcha. And these are things that are within our control. Yeah, absolutely. Things we can change and modify.
So what are some of the big ones when it comes to lifestyle?
Well, diet is a huge one.
Okay.
What you eat really does impact your blood pressure.
Makes sense.
Things like eating a lot of salt,
Uh-huh.
processed foods, which are often loaded with sodium,
Right.
unhealthy fats, sugary drinks, all of that can contribute to high blood pressure.
Okay. So, cutting back on those things
Yeah, absolutely.
can make a big difference.
Can make a huge difference.
Gotcha. Now, what about, I know exercise is always important.
Yes, absolutely. Exercise is crucial.
Like, how does that play into hypertension?
Well, when you exercise regularly, it actually helps to strengthen your heart,
Okay.
and it makes your arteries more flexible,
Gotcha. Okay.
which then helps to lower your blood pressure.
Okay. Now, one thing I found really fascinating in that video we were talking about
Yeah.
was the link between gut health and hypertension.
Oh, yeah, that's really interesting.
I'd never really thought about that connection before.
It's not something that people traditionally think about,
Oh.
but there's a growing body of research showing that the bacteria in our gut,
Our microbiome.
our microbiome, exactly,
Yeah.
can actually play a role in regulating blood pressure.
Wow. And so, like, how does that work?
Well, we're still learning a lot about it,
Okay.
but it seems that certain types of bacteria can actually produce compounds that help to dilate blood vessels,
Okay.
which would lower blood pressure.
So, like, the healthier our gut is,
Right.
the better our blood pressure is,
Yeah.
potentially.
Potentially, yeah. And there was actually a study published last year
Oh, wow.
in the Journal of the American Medical Association.
JMA?
JAMA, exactly.
Right.
And they found a strong correlation between gut bacteria diversity and blood pressure regulation.
Okay.
So the more diverse your gut bacteria,
Hmm.
the better regulated your blood pressure tended to be.
That's amazing. And that just goes to show you, like, how interconnected everything is
Yeah.
in our bodies.
Right.
It's not just like, one organ doing its own thing.
Right.
It's
well,
all connected.
everything's talking to each other.
Yeah. Okay, so we talked about diet, we talked about exercise.
Uh-huh.
Are there any other lifestyle factors that can play a role here?
Yeah, so stress is a big one.
Okay.
When we're stressed, our bodies release hormones
Right.
like adrenaline and cortisol.
Yeah.
And those can actually cause our blood pressure to spike.
Okay.
So it's really important to find healthy ways to manage stress.
So like what are some things people can do?
There are all sorts of
Right.
Exercise itself can be a great stress reliever.
Right.
But things like meditation,
Uh-huh.
yoga, spending time in nature,
Yeah.
deep breathing exercises,
Okay.
all of those can help to lower stress levels and in turn lower blood pressure.
Gotcha. So it's not just about, being physically healthy, it's about mental health as well.
It's about the whole package.
Yeah, okay. Now, we've been calling hypertension this silent killer.
Mm.
So what does that mean? Like,
Yeah.
if it's silent, like, are there symptoms?
That's the tricky thing. A lot of times,
Yeah.
especially in the early stages of hypertension, there aren't any noticeable symptoms,
Wow.
which is why it's so important to get your blood pressure checked regularly,
Okay.
because you might not even know you have it.
So, like, when should people start getting their blood pressure checked regularly?
It's a good idea to start getting it checked at least once a year,
Okay.
starting in your early 20s,
Okay.
and even more frequently if you have any risk factors.
Okay, so like family history,
Family history,
things like that.
obesity, any underlying health conditions,
Gotcha.
things like that.
Okay, and then are there ever times when there are symptoms?
Yeah, so as hypertension progresses,
Okay.
you might start to experience things like
Okay.
frequent headaches, dizziness, blurred vision,
Okay.
and in severe cases, even chest pain.
Now, is that like a heart attack or is that something different?
Chest pain can be a sign of a heart attack,
Okay.
but it can also be a symptom of other things.
Okay.
So if you're experiencing chest pain,
Right.
it's always best to err on the side of caution
Yeah.
and seek medical attention immediately.
Call 911, yeah.
Absolutely.
Okay, so if someone like is walking around with hypertension and they don't know it
Right.
and they don't do anything about it, what are the long-term dangers of that?
Well, untreated hypertension can lead to some very serious health problems.
Okay.
It's a major risk factor for heart attack,
Okay.
stroke, kidney failure,
Wow.
vision loss, even dementia.
So this is serious stuff.
It's not something to take lightly,
No.
which is why early detection and management is so crucial.
Okay, so let's talk about that. We've scared everyone now, appropriately so.
Right. Hopefully motivated them.
Yeah, hopefully motivated them to take action. So let's talk about like what can people do, if they do find out they have hypertension or if they want to prevent it, like what are some steps they can take?
Well, the good news is that there are a lot of things people can do,
Okay.
both to prevent and to manage hypertension.
Okay.
And it really starts with those lifestyle changes we were talking about earlier.
Okay, so let's break those down one by one.
Sure.
Like when it comes to diet, what are some specifics that people can do?
So one of the most important things is to reduce your sodium intake.
Okay, and that's salt, right?
That's salt, exactly.
Okay.
The American Heart Association recommends no more than 2,300 milligrams of sodium per day,
Okay.
ideally even lower.
And like how do people actually do that?
Well, it involves reading food labels carefully,
Okay.
cooking more meals at home,
Gotcha.
where you can control the amount of salt,
Right.
and choosing fresh or frozen foods over processed foods.
Because those tend to be.
Bloated with sodium.
Yeah. Okay.
Another important dietary change is to cut back on saturated and trans fats.
And those are found in like.
Those are found in things like fatty meats,
Okay.
full-fat dairy products,
Right.
fried foods, baked goods.
Okay, the delicious stuff.
Yeah, the not-so-good-for-you stuff.
Yeah.
And then also limiting added sugars.
So that's like sugary drinks,
Sugary drinks,
candy, processed foods, things like that.
Okay, gotcha, okay.
And then on the flip side,
Yeah.
you want to increase your intake of fruits,
Mm-hmm.
vegetables, whole grains,
Okay.
lean protein.
Gotcha. And so, like, what about potassium? I heard that's important for blood pressure.
Potassium is really important.
Okay.
It actually helps to counteract the effects of sodium.
Oh, okay.
So foods that are high in potassium are things like
Okay.
bananas, sweet potatoes,
Uh-huh.
leafy green vegetables.
Gotcha. Okay. So we've tackled diet. Let's move on to exercise.
Yeah.
Like, what are some specific recommendations for people? So aim for at least 30 minutes of moderate intensity exercise
Right.
most days of the week.
And moderate intensity, that means like,
That means you should be able to talk,
okay,
but not sing
okay, gotcha.
while you're exercising.
So like brisk walking,
Brisk walking.
swimming, cycling, dancing, gardening, even
Yeah.
anything that gets your heart rate up.
Got it.
Okay.
And then we talked about stress management. Like, how do people actually do that? Like, in a practical sense.
Yes. So find what works for you.
Okay.
You know, some people find that meditation is really helpful.
Uh-huh.
Others prefer yoga or Tai Chi.
Okay.
Spending time in nature is always a good one.
Yeah.
And then just make sure you're taking time for yourself
Okay.
to relax and do things you enjoy.
Right. Because that can really build up
Oh, yeah.
if you're not taking care of yourself.
Absolutely.
Okay. So we've got diet, exercise, stress management.
Are there any other things that people can do to either prevent or manage hypertension?
Yeah. So if you smoke,
Yeah.
quitting smoking is huge.
So,
Smoking raises your blood pressure,
okay.
damages your arteries,
Gotcha.
increases your risk of heart disease.
Okay.
So quitting smoking is one of the best things you can do for your overall health.
Got it. And what about alcohol?
Alcohol can also raise blood pressure,
Okay.
so it's best to limit your intake
Okay.
or avoid it altogether.
Gotcha. Okay. So we've gone through all these lifestyle changes. What happens if, someone does all of that and their blood pressure is still high?
Well, in those cases,
All right.
medication might be necessary.
Mhm.
There are a variety of different blood pressure medications available,
Okay.
and they work in different ways
Good.
to lower blood pressure.
So, like, what are some of the different types?
So some common types include diuretics,
Okay.
ACE inhibitors, beta blockers.
Okay. And these are all things that, like,
Mm.
a doctor would prescribe.
Yes, absolutely.
Okay. You should never start taking any medication
Right.
without talking to your doctor first.
Got it. Because they can have side effects.
It can have side effects. And
Interactions with other medications you might be taking.
Right. Okay. So it's really important to work with a healthcare professional
Absolutely.
on this. Okay. Well, I feel like we've really covered a lot of ground here.
Yeah, we've gone through a lot.
So to kind of sum it all up for our listeners, hypertension or high blood pressure
Mm-hmm.
is a serious condition,
Mm-hmm.
but it's one that is often manageable.
Right. Absolutely.
We talked about its causes, the genetics, the lifestyle choices,
Uh-huh.
even the fascinating link with our gut microbiome.
That was a really interesting one.
Yeah. We talked about those sneaky symptoms,
Mm-hmm.
or sometimes the lack thereof.
The silent killer.
Yeah. Which makes it so important to monitor our blood pressure regularly.
Absolutely.
And then, most importantly, I think, we outlined all the steps that people can take to prevent and manage it. The diet, the exercise, stress management.
Medication if needed.
Yeah. So it's really about, taking control of your health and making those informed choices.
It's empowering
Yeah,
to know that you have some control over this.
absolutely. And, that actually brings us to a final thought
Okay.
for our listeners. Given that hypertension is on the rise globally,
It is.
are there other factors that maybe we're not thinking about that could be contributing to this trend?
That's a great question.
Yeah, I mean, we talked about, the individual level things,
Right.
but are there things like on a societal level or an environmental level?
It's certainly possible.
Yeah.
Things like air pollution,
Uh,
exposure to toxins,
Right.
chronic stress from modern life.
yeah,
Those could all be playing a role.
that's definitely something to think about,
It is.
and maybe something we can explore in a future deep dive.
I like it.
Yeah, so until then, stay curious and stay healthy.
Stay healthy, everyone. Host speaker.